today we have a very renowned homeopath, Dr. Abhay Patil, a good friend of mine. And he has been in practice for more than 25 years, I suppose, Abhay. So,
yes,
and he has,
around 28 years, yes.
yeah, around 28 years. So, and today is going to talk about scope of homeopathy in oncology, and he has a vast experience. And I'm sure that we are really glad that he's with us on a Sunday morning. So, Abhay, you can briefly introduce yourself, and we can start with the session. We already have 47 participants, and we are
Okay.
increasing. So, we'll start. Okay.
Yes.
Welcome.
Good morning, all. Well,
good morning, sir.
Good morning. See, today being Sunday, and we are going through a tough disease, or we are going to talk about a tough disease where everybody is scared to treat cancer. I'm a classical homeopath and been practicing for past 28 years. And I want to thank Dr. Samir and Batra Academy for giving me this opportunity to speak on a difficult topic like cancer. Yeah. So, role of homeopathy in cancer. First of all, you have to understand what should be your quality, whether are you capable of taking cancer cases, or what should be your expertise when you take up cancer cases. Because it is not like simple cough and cold, or it is not like skin diseases, or it is not like even rheumatism or other chronic diseases where you have got time. In cancer, time is precious. So the knowledge of disease, like Hahnemann has explained in Organon, is very important in cancer. Means whomever you are treating, which pathology you are treating, which type of cancer you are treating, you should have up-to-date knowledge about that disease, about the progress of the disease. What are the chances of cure? What is the chances of longevity? How does it metastasize? Which organs can be involved? So you are not taken by surprise. Like I had one patient, the patient was generally very much better. What criteria we have in homeopathy? Okay, the appetite should be okay. The patient should not lose weight. Patient should be mentally and physically healthy. He should be active. So case of lung cancer. Treating him. What normally we tend to do, okay, everything is good, no need for investigation. No, here's is where we make a mistake. So we got a PET CT done of the patient. The cancer had spread nearly 3/4 of his lung. So then I know that there's some mistake from my side. Even though he is matching the parameters for homeopathic treatment, still the patient is becoming pathologically worse. So what would we say? I know it is just an aggravation. No, just understand, in cancer you cannot afford an aggravation. Or there is an aggravation and after that the patient is feeling better. This is the statement made by patients who come to me after doing some homeopathy elsewhere. उन्होंने बोला डिसीज बाहर आ रही है, अरे बाबा बाहर भी नहीं आ रही है. The disease is progressing. So you have to understand what is the pathology. So in this case, you have to get a PET CT done, you have to get a spirometry test done, you have to get the oxygen level checked up. So the patient was just scared to go to a oncosurgeon or an oncologist. So he was telling better. And वो जबरदस्ती खा रहा था. He was just eating for the namesake of eating, and he was not explaining this to us or nor his family. So role of investigations becomes very important. Understanding the pathology is important. Secondly, you have to be convinced yourself that you can treat cancer. There was a case around 7 years or 8 years back, a case of CML, chronic myeloid leukemia. It was a friend. He was a friend of mine. His mother had this problem. So she was taking treatment from another homeopath in London, in UK. So when she got diagnosed, she told, "Nee, homeopathy cannot treat this. It is CML and her age is more." And they were strong homeopathic followers. The patients were strong homeopathic followers. She was scared to take up the case. Now, if you know pathology, you know the CML cannot progress very fast like AML or ALL, acute leukemia. CML, you have got time. So we got a bone marrow study done. We got her investigated. Yeah, multiple organ involvement. But I told, okay, give me some time. Give me 3 months. Let me see. And they didn't want to go for chemo, or she was, I think so, around 70 years that time. No, sorry, 68 years that time. And she survived till last year. Without any allopathic intervention, no chemo, no Velcade, no bone marrow transplant, no stem cell therapy, nothing, no blood transfusions. Her hemoglobin was remaining around 912, sorry, around 9, 8, 9, 7, 8, 9. It was fluctuating. We were changing the medicines depending upon the symptoms. That will come up later. Why, how do we prescribe? Unfortunately, in COVID, she expired. So she didn't die of cancer. She didn't die of CML. And even in COVID, she got scared and she took steroids and her body was not able to take it. And she demised. But the relatives, the patient's family, they are all with me even now and they're referring cases. So you first yourself should be convinced that homeopathy can treat cancer. Like I told you, pathology, so you have to understand the stage of the disease. What stage the patient is in. First, second, third, fourth. Now, allopathic stages and homeopathic stages are different. I will come up to that. So we have got first case of stage patients who die within 3 months. And we have got fourth stage cases of cancer who are even surviving for 2 years, 3 years down the line. So the stages of a homeopath and stages in allopathy are slightly different. Like I told you, pace of the disease and the importance of patient's response is again very important. What do you mean by pace of the disease? Like I explained, pancreatic cancer, hepatocellular cancer, HCC, brain, gliomas, and compared to adenocarcinoma, squamous cell carcinoma. Adenocarcinoma gives you some time. Squamous cell carcinoma are more difficult to treat. Then in a pathology report or a biopsy report, we see differentiated adenocarcinoma or cells are well differentiated. And another pathology report, we see poorly differentiated carcinoma or cells not at all differentiated, again, the cure rate varies or the control rate varies. So, person with a clearly differentiated CA, where the cells are still seen or they have got its own characteristics, the results are very good compared to an undifferentiated one. In breast cancer, those who are ER/PR HER2 positive tumors, means hormone dependent tumors, even in rectal cancer, in prostate cancer, and those who are negative, HER2 negative, ER/PR negative, again the prognosis varies. Hormone dependent tumors respond very well to homeopathic medicines. While non-hormone dependent tumors, they don't respond to homeopathic medicine as well. Means this is a comparative studies which I'm talking about. So you should have a clear-cut understanding of the disease, and of course homeopathic knowledge is important. So if I classify the scope of homeopathy, so like I say we have got stage 1, stage 2, stage 3 or last stage of cancers. In general, this is general classification. I'm not going into 4 stages, or there are so many stages which are classified in cancer. I'm not going to go in details of all that because beyond the scope of this lecture. So homeopathically, a stage 4 patient comes to you where the doctors have given up, but he gives you multiple characteristics. He gives you PQRS symptoms after taking the case. He gives you strong mental symptoms and strong physical symptoms which are not related to the disease. So you have to understand disease symptoms, you have to understand patient constitutional symptoms. So even the 4th stage who is here, but for me he'll be stage 1 and the results are fantastic. Patient responds very fast to homeopathic treatment. The quality of life of the patient improves even if the cancer doesn't go. Mind it, I have got cases who are 5 years, 6 years down the line treatment, the cancer is remaining, but it is contained. And patient is not on any other therapy except homeopathy, like I had told about CML. There are few cases who got cured, but the results are rare. So again, I'm telling we are not claiming cure. Cancer is controlled because cancer, what do you mean by cancer in layman's term? It is uncontrolled growth of cells. So even if you're able to control it, it is cure. So cancer is basically not a disease. According to me, it is an altered self. So even a multiple metastasis case, but who has come to you with typical symptoms, like how you take up a case, you prescribe constitutional remedy, you may require some other remedies in between depending upon the state the patient presents, and the case is very easy for us. You don't have to knock your head at all. Then we have patients who have come to us who is already on chemotherapy, radiotherapy, who is of old age. Mental state of the patient is not optimistic, or even a first stage patient comes to us, but he's already very scared. He's already in a panic state. and there is not a much support system for him mentally. Difficult case, difficult to solve. So now the treatment varies in this stage 2. Again, we have got excellent results in stage 2, where chemotherapy and radiotherapy has started. Patient has done a surgery. This type of cases, usually you see breast cancer cases, prostate cancer cases, liver cancer cases. Now, liver cancer results are much better. Rectal cancer cases, colon cancer cases. Even in this stage, I can say homeopathy acts very well. Now, there would be two lines of treatments in this. One is when the person is on chemotherapy, the line of treatment differs. So usually, before chemotherapy, I give a drug to a patient, I give a remedy to a patient. After chemotherapy, I give, means before the chemotherapy sessions. Let's say a person is advised, 6 chemotherapies or 5 chemotherapies. Usually 3 chemotherapies are done. They get a PET CT done, and then they do another 3 chemotherapies. This is the role, usually 90% of cases. Or radiotherapy, approximately 4 to 6 weeks, around 20 to 28 cycle of radiotherapy is been done. There's Monday to Friday they do radiotherapy, Saturday, Sunday they don't do. So again the line of treatment changes. So when the person is of chemotherapy, constitutional remedy doesn't work. Radiotherapy, constitutional remedy doesn't work. You will have to prescribe some remedies which have got the side effects of chemotherapy or radiotherapy, where cadmium salts are very much indicated as far as radiotherapy is concerned. Chemotherapy, we have got arsenic, so many other drugs. Bad effect, veratrum, bad effect of chemotherapies, if we see it in repertory, or when you analyze the symptoms, accordingly, each and every person produces a different sets of symptoms after chemotherapy. There are some common symptoms which are related to chemotherapy, and there are some symptoms which are different, which are unexplained. So we usually target such type of symptoms. Again, the results are very good. Like what I said, the study we did in Assam, the patients are still surviving and they are still under homeopathic treatment after the chemo and radio has been done. The results are very good. But here the chances are around, let's say 50-50. And last stage of cancers, where there is metastasis, where the patient is in stuporous condition. He has lost 20 kgs, 30 kgs weight. Here, constitutional therapy doesn't work at all. Constitutional remedy doesn't work at all. You will have to concentrate on organo-specific medicines. Few cases, mother tinctures. And I request the host to mute all other participants.
I'm here, Abhay, so I'll be muting. The problem is if I mute everybody, even you get mute, and again we'll have to unmute you. So I'm keeping a watch on.
Yes.
And there's a request to all the participants. Please, there is no need to unmute yourself unless you really want to ask some question, which can be at the end of the session. This disturbs the speaker and the flow also. So kindly keep yourself muted. Keep a little responsibility so that the speaker is not disturbed. Okay. Please continue, sir.
Okay, thank you, Dr. Sameer. So where I was, okay, last stages, where the role of mother tinctures, role of organo-specific medicines, and only palliative role as far as homeopathy comes up. Here also homeopathy, I have seen, has got excellent results as far as palliation is concerned, well, people who are even bone cancer patients, that is supposed to be one of the most painful type of cancers, we have treated them without morphine. I won't say all cases, but at least 50% cases have responded. Severe bone pains, not responding to morphine patches, Voveron patches, IV, they are under palliative allopathic care or palliative allopathic pain care clinics. Still, they respond very well to homeopathic treatment as far as palliation is concerned. There are relatives of patients in this stage. There are few families who have got 3-4 cases of cancer, and they say, no, we don't want to go for conventional cancer treatment. We want to continue only with homeopathy. And they have only been on homeopathy in last stage, means old age patients diagnosed very late. And we have been able to maintain them well. Like I said, only 1 week max of hospitalization, that too if required. Otherwise, a setup at home only, where we arrange from the local doctor out there IV or albumin if required. Esophageal cancers or last stage cancers with metastasis, where it is completely, where you'll need a PET tube, you will need a Rice tube. And maintain the patient well without much complications. So this is how we treat the stages of cancer. Means first stage, lot of characteristic constitutional. Second stage, chemotherapy, radiotherapy, those who are undergoing or undergone medicine change. And last stage, no constitutional therapy, because it can lead to aggravation or it can lead to killer's aggravation. So we have to be very careful. Now again, I'm saying first stage of cancer. Now what again, whom are you going to treat? Like you get a first stage of cancer, but it's a esophageal cancer. Where there is, I got a case right now, where there is no metastasis anywhere in the body. But the patient is not able to swallow at all. Because he's hardly able to take liquids. Now the relatives are asking me, what should we do? So here, I'm not only going to advise in homeopathy, because he's under my treatment for past 2-3 months. We got a PET CT done, and the disease is absolutely under control. But he's losing weight because of the obstruction at that end. So I talked to my oncology friend. He said, okay, if they don't want to go for any other treatment, let them take at least radiotherapy. We will try 5 radiotherapy sessions, spot radiation, so that he gets relief and he's able to swallow. So I said, yes, let us go ahead with that. So we should not be dogmatic at that level, where the chances of survival, where there is chances of survival is very good, because there is no meds anywhere. But he's not able to swallow. He's not able to take food at all. So I told him, either we put a Rice tube or we feed him directly through the stomach, and you continue homeopathic medicines. So that this patient can survive for minimum a year or 2, minimum, or he may survive more also. So again, you should know where to advise and what to advise. Same way in rectal cancer, where there is complete blockage, the patient is not able to pass stool at all. but there is no metastasis. It is still localized. So here is where we follow handyman in method that, okay, this is a surgical disease, or this is where he may require radiation. Our prime aim should be to give relief to the patient, not only stick to homeopathy or allopathy, because cancer is a holistic science. We have to target it holistically. That's why the name of my clinic is also holistic healing. We should not be only sticking to homeopathy. You may require other line of treatments also. So you have to take a rational call in such cases. And the results are very good, especially rectal cancer, esophageal cancer, duodenal cancer, even lung cancer, where a combination treatment, the patient can survive for 10 years, 11 years down the line. Means we have got so many cases of breast cancer or even esophageal cancer who are very healthy, active. So again, where to give homeopathy and where not to give homeopathy, and where to use alternative line of treatment. So this becomes very important. So what conclusion we have come to, or I have come to? Basically, cancer cell occurs because of a defense mechanism. Either it is because of a defense mechanism or because of greed. So what is cancer? It is multiplication of cells. So it is basically not a disease. It's an altered self of yours. It's basically the cell starts thinking that I can take over the whole body and I can survive, but in that thing, in that emotion, he destroys himself. So it's basically a greed or a defense mechanism. So now these stimulations can be external stimulations or internal stimulations. For example, just share another screen.
So did you use the word greed when you talked about cancer cells?
Yes.
Oh,
It's basically greed.
I just wanted to know a little more about why you use the word greed and what's the thought.
I'll come to that. Okay. Are you able to see my screen? Okay. Now suppose we consider this as a cell. Okay. Now this is the nucleus. So what basically is cancer? It is multiplication of cells, right? So the causes can be one, it can be an injury, repeated injury. So what do you mean by mind my handwriting? It's bad. So what does a repeated injury mean? So repeated injury can be an emotional injury, can be a physical injury, or it can be an external cause. Like simple mathematics is physical injuries, like you are eating tobacco on a regular basis. You are eating mawa on a regular basis. Or you have got a teeth which is deformed and it is continuously injuring your buccal cavity. Or you are a farmer who is working in farmlands and they use lot of pesticides. Pesticides contain arsenic. or you are working in a coal factory, or you are working in a mine, or at present we are exposed to so much pollution or pollutants. So this is what I mean by recurrent injuries or repeated injuries. So repeated injuries first will lead to inflammation. The cell will go on getting inflamed. Got it? So inflammation occurs to protect itself. Even then, if the injury goes on continuing, then you get induration or thickening. That is benign, or what we call as benign tumors, thickening of tissues. Callosities, for example. Corns, for example. Simple examples. Third thing is either your body will go into, okay, now still the injury is continuing, mental or physical. Either it will go into destruction, like we have autoimmune diseases, like we have multiple sclerosis, motor neuron diseases, aplastic anemias, where the body's mechanism fails completely. Or it will go into multiplication. Simple theory. I'm not adding much. It's a simple physiology. So, like I said, greed. That was the question asked. So, greed, according to me, is multiplication. It is protection. Means what you tend to do, you have got that fear of starvation or fear of losing money. So, you tend to accumulate more and more. It may be because of fear, it may be because of greed. So we have got remedies like calcarea floor. Excellent remedy for cancer, especially bone cancer, where there is insecurity. Continuously fear is there. The person lives in fear that he will be subjected to starvation or loss or poverty. A person like Staph aureus, an excellent remedy for cancer, especially after alcohol, tobacco, cured or helped many cases of cancer with Staph aureus. The feeling is that he has to control himself. Like we have got argentum nitricum, like we have got Staph aureus, we have got gelsemium. But most marked is Staph aureus because he's a sensitive person. So that continuous fear is there. So what happens? He takes it. He takes that vexation. He takes that indignation on a continuous basis, and one day he bursts.
Hello, sir. Good morning.
Yeah.
Sir, could you please explain this again? Like I caught up till injury, repeated, physical or mental, but after that I could not understand much. So could you please repeat? It's an important concept.
Forum, can you please refrain from disturbing the speaker in between forum, please? Because questions are supposed to be at the end, okay? So when the speaker is speaking something, stop. Please refrain yourself from disturbing him, okay? Kindly.
We'll come to it. We'll come to questions regarding how much I understood, or according to my capacity, I will try to answer all the questions. But again, now just because this came up, like I told you, inflammatory reaction, like we call SORA. Induration or thickening, we call psychosis. See, actually, according to Henneman, all diseases are psoric, even including cancer. Including cancer. But like what we have been taught or what we have been teaching, so on a simple terms, if I have to tell that first is psoric response, that is inflammation. Induration would be a psychotic response like thickening, like your skin gets more and more thickened. You tell you are a thick-skinned person, nothing affects you. So why nothing affects you? It is like meadorhinum. You try to hit your head against that person and he doesn't change his opinion. Like thuja protects himself. Like thuja plant, you cannot see the stem. It protects himself everywhere because he thinks he's fragile, he's brittle. So he doesn't allow anybody to penetrate him. This is what I mean by induration or thickening, or having a protective layer against you. That is what we call psychosis. Then ultimately, again, if the injury goes on continuing, it is beyond your capacity to take it. Like the example I always give to my patients, like a camel, you go on putting weight on that camel. Means his capacity is 100 kg or 200 kg to take. But you put 210, then it suddenly collapses. That is what I mean by collapse out here. Where either the camel will die, destruction, or you may have to get multiple camels, or in yourself you will create more and more cells, multiplication. Or syphilis, both are syphilis, positive syphilis, negative syphilis. So again, like I said, cancer is not a disease, it is an altered self. It is basically a defense mechanism, or it is a greed. Now greed can occur because of fear. So it can be emotional fear, it can be materialistic fear, it can be disease fear, there can be so many fears, so many delusions like we know. If we analyze ourselves, we will realize that we tend to land up in the same situation throughout our life. Like a staff will be susceptible to humiliation. Arsenic would be susceptible to cheating because he has got a fear of getting cheated. Stramonium, darkness. Aconite, panic state. Argentum nitricum, control. So this is the core of you. This is the core personality. This is the core personality of the medicine. Accordingly, you will tend to land up in diseases. So that would be an internal cause, or a genetic, means whatever you are taken from your parents. And physical causes, like I told you, tobacco, smoking, pollution, coal, pesticides, exposed to metals in general, lifestyle disorders. So the cancer cell has its own mind. Means what I always insist to my students, that when you are treating cancer, you are treating two personalities at one time. One is cancer personality, where it doesn't have any control, where the control gene itself is gone. And the second personality is a person who is diligent or who is in control. So depending upon which stage comes up, the medicine goes on changing. So that is why in cancer, constitutional remedy doesn't work 50% of the time, because you will have to treat them as multiple personality disorders. So we'll come up on this concept in more details when it take up future lectures. But this is a very important point. So again, as I explained to you, this cell goes on multiplying at such a rate. So either it multiplies and protects itself, like then it becomes a benign tumor. Or it multiplies at that level where it goes on metastasizing everywhere and he thinks he's the king and he can conquer the body and the person dies. So he also dies along with it. So it is like a virus. So the concept of virus causing cancer is also very high. CMV virus, toxoplasma virus, leading to cancers. Even now, after COVID, we are seeing lot of multiplication of cancer cases. Means cancer cases, they have said that we have got COVID. After 6 months, we have developed cancer. So virus as a cause of cancer is also coming up very strongly nowadays. And vaccination. So vaccination, basically you are inducing a virus. So the drugs Thuja, Malandrinum and Vaccinum, Mercury, I'm using them quite frequently nowadays and getting good results post-vaccination. So this is what I mean by injury. Now injury, like I told you, it can be physical and mental. So during case taking, we try to find out what could be the probable cause. And this cause, does it still have an effect on your body? See, once the effect is gone, you're beyond that and the cause becomes least important. This is what Hahnemann has said, then in chronic disease, the cause becomes least important if the duration is very high. But then if you're able to predict, or if you're able to, the time difference is very less, like vaccination or COVID, then you will have to take up that thing. And the results are very good. So like I said, Staphylococcus aureus, one of the most important remedy, continuous humiliation, vexation, and then his body goes into a defense mechanism where he loses his control. I am not going to listen to anybody. I'm going to become an alcoholic. At a mental level, at a physical level, he develops. I have seen many cases of intestinal as well as kidney cancers when it comes to Staphylococcus aureus. The injury remedies, one of the best injury remedies, arnica or ruta, symphytum, excellent remedies for cancer. So another concept which I had, I think you all may not have, is okay, don't think of plant remedies in cancer. Actually, it is vice versa. Think of plant remedy in cancer always. Don't think of metals or don't think of minerals. I'll just share my PowerPoint presentation again. Don't think of metals, don't think of minerals. So if you repertorize, what are the common remedies in plants which we use for cancer? Conam, Phytoleca, Arnica, Lycopodium, Chelidonium, Chionenthus. There are so many plant remedies which are being used for cancer and which we straightforward used to rule it out. Cancer hai, don't give plant remedies, are superficial. No, plant, even Stramonium, insectivorous plants like Drosera, Spongia, excellent remedies for cancer. Bellispur, excellent remedies for cancer. Metal Abrotinum. So in fact, plant remedies are the fastest acting remedies for cancer. Like I had one case, sudden fear, fright leading to cancer. It was a case of, I think so, it was ALL. They said it is ALL, starting stage. Person had developed fright and he was clinging. So simple remedy, stramonium, I gave it in 10 ml single dose. It was like an acute case. After 1 month, all reports normal. The doctor said the blood report was, the diagnosis was wrong. How can the diagnosis be wrong? So the reaction becomes very important. Metals, where I use in brains, minerals. See, now you have to understand the pace of the remedy. You will find the pace of the remedy faster in plant remedies compared to minerals like calcarea floor, for example, or even other remedies like minerals. They themselves are slow constitutions. How can they work in fast cancer cases? So they are best used in benign tumors or cancers which are slow progressing, like breast, it may be rectal cancer, prostate cancers, where you will find mineral remedies more indicated. All other cancers, you will find, even HCC, pancreatic, you will find plant remedies indicated more. So this is another paradox. So like I told you, causes, accidents, chemical exposures, tobacco. What is the time? 11. Okay. Stress, continuous stress causes a continuous stimulation on you. Anger, humiliation, insecurity. Like continuous anger, like I told you, Staphylococcus aureus, one of the most important remedies of cancer. So anger and tobacco, alcohol combination, all three together. Excellent remedy, Staphylococcus aureus. Humiliation, insecurity, calcarea floors. Sudden life events. Sudden life events means death of a family member, death of a partner, death of a child. So according to that, the person goes into paralysis type of a feeling and develops cancer. So you find a drug where a person may require aurum or may require natramur, and the person has become extremely frail. He is hot and emaciated. The drug is muriatic acid. Exposure, like chemical, like what we are telling, pesticide, a drug where you require a person has a lot of burning, like arsenic. But the stage is beyond arsenic. Means that fastidiousness or disciplined nature of arsenic has gone off. Think of anthracene. Works very well. Last stages, think of acids, acetic acid, muriatic acid, picric acid, phosphoric acid. Very good results. And one of the common drugs which I used, or remedies which I used, especially for cases from Assam. In Assam, how it is that tradition, like we offer tea, they offer betel nut, tobacco, and supari. So that is the tradition. So majority of them have mouth cancers or stomach cancers. That is what we are commonly seen. Then I tried, okay, first start with tabacum directly, or abyss, specifically cardiac end of the stomach, ailments from tobacco. Excellent results. The patient showed improvement in 2 to 3 weeks time, followed by a constitutional remedy, which whatever I thought, but remove the cause caused by that particular tobacco or smoking. So you can take the rubric ailments from tobacco or smoking, collapse or tobacco heart. Along with that, they get palpitation or collapse. Excellent remedy, tabacum. Then patients who are not responding, they go into fear, or they hear news of cancer and they go into, suddenly they stop speaking, they don't respond to you at all. Give opium first, they come out, then start your other remedies. So prescribe on the state. If possible, try to include the cause and see the genetic factors also along with it, or the surrounding factors, habits, diet, exercise. All these things become very important. One most important point I forgot when I was disturbed in between. You cannot only give homeopathic treatment. You have to change the lifestyle of the person. That includes yoga, meditation, diet, sleeping on time, eating on time, mental support, counseling. All these things play a very important role in cancer treatment. So a patient comes to you and he's very negative, you're treating him, you feel that homeopathy will change his state. No, it will not change his nature or state immediately, especially not in cancer, where he himself, the most important cause or hindrance in cancer treatment is the relatives. Because they'll be bombarded with thousands of opinions. तुम इधर जाओ, ये खाओ, ये पियो, ऐसे करो, वैसे करो. The patient goes into a confusion state, or he takes multiple line of treatment. So then here comes your role as a physician or as a counselor. You have to explain to them, so this medicine is working, give me time, I'm sure I will be able to help you. If I am not able to help you, you think of alternative line of treatment. Till that time, you only concentrate on your diet, you do exercise regularly, sleep on time, and be positive. Simple solutions. No need to complicate things. So along with treatment, external factors become very important. Like I said, fight and flight mechanism. A person may go into autoimmunity. Like a lion comes in front of you, you try to fight, you are going to die. You get fearful, you sit there, still you are going to die. A normal mechanism would be to keep your head sound and climb a tree. So we are always in this two mechanism, flight or fight. Any stimulus which we tend to land up in, we either try to fight or we escape from the situation. Both the things lead to disease. So this is SNS activation, corticosteroids which are increased. I don't want to go in these details. You can just take a screenshot of this slide. So if we are able to control this fight or flight mechanism in a patient, the patient can be helped or he can get cured. So like I said, cancer as a greed or insecurity, greed for more. This is a paradox of self-destruction. Yes, you become so greedy that ultimately your core itself is gone. You feel you can conquer the world, but at the same time, like we say, you become workaholic so much that you leave your children, you leave your family. You just run after money and you see your family getting destroyed out here. So for what you were doing, for whom you were doing, the purpose itself is lost when the cancer cells multiplying. That is what I meant by greed and insecurity. Because you feel it is not enough. Like COVID has taught us just a small microscopic, not even a microscopic organism. Such a small organism can create a havoc. So you are nothing. So it is better to be contented. So for cancer treatment, in counseling, we always say to the patients, try to be content. Like I had one patient of ulcerative colitis leading to Crohn's disease, leading to CA, a young chap. He was the world head of Standard Chartered. Always traveling. Then one day he left his job. This is around 1.5 years he left his job. So just by doing that, he started concentrating on exercises, meditation, and of course homeopathy. He is now symptom free. He does not show any symptoms of cancer of colon. So this is what I mean by cancer, greed, and insecurity. Cancer as greed and insecurity. So the parameters, like I told you, diagnosis, first of all, you have to know the pace of the disease. Accordingly, you have to match the pace of the remedy. Means for HCC or pancreatic cancer, you are never going to give a remedy like calcarea ka or baraita. The pace itself doesn't match. It is not going to work. You will have to give fast acting remedies. You will have to think of halogens like phosphorus, or if you want to give baraita mure or kali iode, kali mure. So this, along with minerals, you will have to think of these components: muriatic, chlorine, bromine, iodine, or remedies like Merck. So you need a fast acting remedies or plant remedies, which are usually all are fast acting remedies. So the pace of the disease and pace of the remedy both have to match. This is the most important. So if you don't match the speed, it is gone. You will not be able to treat. So you cannot give a fast remedy to a slow cancer, and you cannot give a slow remedy to a fast cancer. Like I told you, differentiated, undifferentiated, that I already explained. If it is differentiated cancer, chances of cure are very high. Like for example, I had a case, I had presented this case in a cancer seminar before. On MRI, it showed, on biopsy, it showed a clearly differentiated carcinoma. I think so it was adenocarcinoma, lungs. And on MRI, also, the lesions were very symmetrical in nature. Means if it was left lung, it was 2 centimeter, right lung also it was 2 centimeter, and exactly at the same place. On taking the history, I found the person to be quite fastidious, particular, and miserly. I gave him arsenic. He got cured. That too within, I think so, 4 months. So even the reports show you the remedy sometimes, and you match it with the history of the patient. no metastasis. You don't know the primary. Means you get a diagnosis, primary not known, and you have got multiple metastases elsewhere, and they are not able to clearly differentiate the path or the lymphatic system from where the disease has traveled. One of the most important remedies is Belisfur, and especially if there is a history of injury. So Belisfur plant or the roots spread anywhere. So very difficult to find out the primary. So this is how, even from the reports, you can come to a remedy. Then importance of patient's response. Metastasis, we have come up, pace of the disease, I have already discussed. Importance of patient's response. What do you mean by importance of the patient? How much patient surrenders to you. This is also very important. If the patient is very doubtful, irrespective of your remedy, how much clear, how much confident you are about the remedy, it will not work. This we have seen in cancer cases. So you have to develop the confidence of the patient in you. So any patient, even after 1 month or 2 months of treatment, he is very suspicious, he is not confident. I tell him clearly, Baba, it is difficult for me to cure. Please find something else. While a terminal case also who is very confident about me, my relation with him develops very well. 101% the patient will respond whichever remedy you give. So the confidence of the patient in you, and you should be able to deliver that confidence. So I always say to all my patients, give me 3 weeks. Let me see how he responds. So in that I judge how much I am confident, how much the patient is confident. According to that, I advise to all my patients. And like I said, mental state of the patient. If he is positive, very easy to cure. If he is negative, difficult to cure. Now, cause of cancer, like continuous you are exposed, like your patient comes to you, the cause is 100%, it is tobacco, and he goes on taking tobacco. It's a maintaining cause, difficult to cure. Drug pace, I already, fast progressive cancers, I think so we have discussed this already. Pancreatic, glioblastoma, squamous, fast acting remedies. Subacute Hodgkin's lymphoma, CML, medium pace remedies. Slow pace colorectal, breast, prostate, where we think about carcinosin, syrinum, thuja, meldorhinum. Antipsychotic remedies are given along with constitutional remedies and organospecific. Then specific organ remedies, liver, bone, breast, brain. This we can take it in future. I think so. It's around 11:20. So we can take up questions now on anything which any query. Somebody raise the hands so we can.
Yeah, Dr. Amlendu Tripathi had raised the hand. Sir, do you have any questions, sir?
Yes.
Is that daraja over? Yeah, Dr. Mitali, please ask.
Dr. Mitali, yes, please.
So my question, sir, is if there's a patient who had ovarian cancer 10 years ago and then completely healed, and after 10 years comes up with a liver cancer, what do we consider this as? Is metastasis a new disease? How do we interpret this condition?
Now, what was the primary? Was the cancer primary liver only, or what was it?
No, primary 10 years ago, it was an adenocarcinoma of the ovaries.
Okay.
And that was just operated, and no chemos, no radiations, nothing. And the patient just, as you said, changed lifestyle, did a lot of change in the mindset, new diet, nutrition. But 10 years later, a cancer patch appears in the liver now.
Now, see, first and foremost thing you will have to take that he's susceptible to cancer. Means he's prone to cancer. This would be the theme in his case. Now, ovarian cancer relapses going to liver are also common. So you will have to find out whether it is primarily there. This is the second thing. Third thing, if she was able to cure herself or control herself with so much discipline and regular regime. One of the most important drugs which I prescribe in such cases is carcinosin. Means that becomes a tendency for cancer. At the same time, the patient has that much control to modify himself to such an extent that he can change the course of the disease. So carcinosin is forced diligency. That is what we call. It's basically cancer, but you are able to control yourself. So such cases we usually start with carcinosin as a remedy, and then according to constitutional we tend to prescribe. But then the chances of her getting all right are more. The reason behind, because there is a difference of 10 years, that much time, if she was able to control, you can definitely cure that patient or at least control her. And adenocarcinoma means again sensitivity related. There is some situation which must have happened in her life where again her sensitivity must have been affected, leading to this disease. So if you are able to find out what she is sensitive about, it will be, you can help her.
So apparently, as you said, a lot of financial insecurity leading to the greed concept that you explained. Financial insecurity driving the greed, pushing her into a lot of work, and so that she creates financial security for herself and the family.
Yes.
And that seems to be the main theme for the last couple of years. Driving her to overdrive, overwork, and maybe burnout and exhaustion.
Yes. So that is the cause, like I had told. So you have found the cause. So just try to, again, she has to change her lifestyle. She has to become content. And if she was able to control it that time, I think so she can control it even now. But liver becomes more difficult. But definitely there is a possibility. But now you are able to correlate that how the cause or the maintaining cause can affect you. We tend to feel, okay, I'm out of the situation, now I'm not going to get cancer. No. Once you have got cancer, means your susceptibility to cancer will always be there. So this changes in lifestyle has to be permanent. In example, I'm getting back pain. I do exercise and my back pain vanishes. But then again, I go into the same lifestyle, working on my computer for long or eating junk food, and my stomach girth increases. I'm going to land up in back pain in a much more severe variety. So this exercises, I will have to continue because I got the tendencies. Yeah. Any other question? I hope I have answered it. Yeah.
Yes, sir. But then the greed-based remedies that you mentioned, you said calcarea floor.
No, it is one of the remedies. Calcarea floor along with bone. Greed, you have got arsenic. You have got calcarea ars in it. There are many remedies. It is not only one. Fear of poverty, you have got calcarea silicata, you have got silicia also. So you have to consider. Then you have got animal remedies. There was some question, animal remedies. Animal remedies, basically in all animal remedies, selfishness is the core. Because survival mechanism is out of competition, or it is out of protection. So survival mechanism is very strong in all animal remedies. So animal remedies are also play a very important role in cancer, where there is competition. Specifically, I give them in undifferentiated carcinomas. One of the most important remedy where I have treated liver cancers is Crotalus horridus. Excellent remedy for liver cancer, specifically adenocarcinoma. In LM potency, I have given them. Yes. Next question.
Hello, sir. Can I ask?
Yeah, please go ahead. Yes.
Sir, as you were mentioning, like in advanced stages of cancer, one should not go for constitutional treatment.
Yes.
So in that case, just supporting based upon symptomatic palliative care
Yes.
should be taken into account. So that the general parameter remains stable for the patient, right, sir?
Yes.
So in that case, if we go for that palliative management, so will that also help in curing the cancer?
See, curing at that stage is difficult. If you ask me, see, what do you mean by fourth stage disease? Like I had explained, there are no PQRS symptoms at all. This is what I mean by fourth stage in homeopathy. Got it? You have got a patient in fourth stage, multiple metastasis, but then you have got PQRS symptoms, or the mental effect and the cause is clearly seen. You can still cure the patient. And here you may not require organospecific or a palliative remedy, or you may give that temporary and then shift to a constitutional remedy and the patient can get cured. Or at least you can give him a good life. What I mean by fourth stage is he's absolutely like a vegetable. He's not showing any symptoms. He's only showing disease symptoms. So such cases to reverse is very difficult, if not impossible. According to me, there is nothing impossible in this world. But still, it's difficult.
If there is some improvement in the cancer stages, and then you can switch over to constitutional also?
Yes, 100%. That is what I'm telling you, no?
Okay.
Means
sir,
if
according to you, stage 3 breast carcinoma, in that case, one should go for constitutional or just palliative?
Again,
Stage 3.
Again, I want to answer it in the same way. Is she showing typical symptoms, constitutional symptoms? Got it? Are there any peculiar symptoms presented by the patient? Now, is the biopsy report clearly explaining differentiate carcinoma or not? Is it ER/PR positive? If it is hormone positive, ER/PR, if the person is positive, chances of recovery are very good. If it is negative, chances of recovery become less. This is my experience. As far as breast cancer is concerned, means hormone dependent cancer chances are homeopathy
prognosis is good.
Prognosis,
good prognosis.
Very
good.
There is
good prognosis.
Yes, good prognosis.
Thanks, sir.
Yes. Dr. Poonam.
So basically, this is the PPP we have to take into account while treating such patients. The prominent symptoms presented by the patient should be taken
the reactivity of the patient. In simple words, homeopathy was susceptibility of the patient.
Right, sir.
Means if you expose the patient to a particular stimulus, what reaction he is giving? If the reaction is more, if the reaction is peculiar to that individual, chances of cure become very high. You can help the patient. These are ideal homeopathic patients. Now, this is beyond the scope of these lectures. Actually, I am using astrology as a methodology to understand the patient. Means I use it as a pathological tool.
Okay.
Means I have got groups whom I'm teaching. Like in Ayurveda, now they have made it a field. So past 10 years, more than 10 years, I've been using that tool, especially in camps when we had to have predictive camps, where we used to see where we are not able to get symptoms from patients. cerebral palsy, uneducated patients. So from the chart, we were able to diagnose ki, Baba, what could be the personality, what could be the chances of cure, and what could be the medicines indicated. Like few of you must be knowing, if there is fire dominant, then we need ambitious, egoistic remedies more. If water element is more prominent, then we give plant remedies or we give sensitive remedies to the patients. If earth element is very strong, means then it becomes related to finance. It means related to minerals. So mineral remedies will come up. If wind
That is
element
more
means
like
history.
personal evolution model you are talking about,
Yeah, personal evaluation model. If it is wind element, then animal remedies become prominent. So I have been using this theory in CA patients, in approximately all patients, and we are seeing good results. So patients who are not showing any symptoms, I use this model, and it has
right, sir?
helped me. It has helped me to take care, to help patients more. Means I'm more sure of the diagnosis.
Fine, sir.
Yeah. Anything else?
Thanks, sir.
Yeah.
Yes, sir. Hello.
Yes, please. Yeah. Go ahead.
Actually, are you telling before also? But I'm not understanding about that. What are you actually doing in cancer patient? Actually, in palliation or cure? With
I didn't get.
how to give medicine patient that in which frequency and in which potency you are giving.
Okay. You want to ask about
No,
potency and frequency.
frequency and potency. And
Okay.
are you going to with cure or with palliation in cancer patient?
You see, you can never claim cure in cancer patient. First and foremost thing is that. ठीक है. Because if you make the term cure, then you will say that at least when I say I can cure cancer, when out of 100, if I'm able to cure at least 60 to 70% of patients, then I will say cure. Okay? The results are not so great in cancer. First and foremost, you should learn. You should think about it. So cure takes place. I'm not telling cure is not possible, but the percentage is less because the patients who come to us are usually who come to us after chemo or radiotherapy, or who are undergoing chemo or radiotherapy. Nowadays, we are getting patients, means now there is a lot of awareness related to homeopathy, where people are only coming for homeopathy and they said, okay, we are ready to die, but we will not take allopathy medicine, or we don't want to go for chemo or radio at all. But such percentage of cases is still less. So such percentage of cases, you can say that chances of cure are more. Especially when I showed you the disease progress as far as homeopathic treatment is concerned, stage 1, stage 2, 3, 4. So where there are characteristic symptoms, where the patient is showing PQRS, where the susceptibility of the patient is good, where he shows good reaction, both mentally and physically, chances of cure comes to 90%, irrespective of the stage.
And which potency you are giving medicine?
Now, potency wise, usually in CAs, I'm giving LM potency, TDS or QDS. I have started prescribing LM and I'm getting very good results as far as LM potency is concerned. Previously, I was using centesimal only, but past 3 to 4 years, I'm using LM potencies for all my CA patients. Also, I'm using remedies like Syrinum, carcinosin, ovarian cancer subjected to IVFs, let's say, or who had taken a lot of hormonal treatments, lot of menstrual irregularities. I start with Aristolochia, clematis. Like somebody was asking organospecific. Then palladium, platina. If I prescribe, then I prescribe metals, especially if I have to prescribe, I prescribe in centesimal potency. Means repetition is maximum once a week. I don't repeat more. Animal remedies also I have seen they act very good in LM potency. Like Crotalus horridus, I got around more than 5 cases of liver cancer, especially which I've seen that they act very well post hepatitis B or C. Crotalus horridus I have given to, and they exhibit symptoms also of snakes. I have given in LM potency very good results. Means alpha fetoprotein has decreased in that such patients. So metals I have still not. I'm prescribing in centesimal only. Plant remedies as well as animal remedies I'm prescribing in LM potency, which I found better results. Now organospecific medicines like hydrastis, Abies canadensis, Abies nigra, all this tabacum, this I repeat 30 initially when I start the treatment, because like I told, I feel the cause could be that poisoning, pesticides, arsenic. I usually give in 30 potencies, continue for around 10-15 days, see how is the response of the patient. If the response is very good, then I continue, and depending upon what symptoms the patient shows, I change the remedy. In cancer, we have to change the remedies frequently depending upon the symptoms shown. So I usually follow Grimmer in that. So if you go through Grimmer cancer remedies, he is the person who was prescribing different remedies on a daily basis also. And once I know that constitutional symptoms are very clear, then it is usually single dose. Repetition maximum once in 15 days or a month. So it depends from case to case. But this is the methodology which I use. Organospecific, acetic acids, and all, muriatic acid, lower potency, continuous repetition. BD or TDS. And if I see an aggravation, I stop.
Sir, organospecific remedy is selected in the last stage, advanced stage of the cancer?
Yeah, advanced stage of cancer only. I don't prescribe. I'm not very confident with it, frankly.
Okay, sir. Sir, can I brief just in 2 minutes about, because my cousin sister is suffering. So I have witnessed all the things she's encountering last 6 months से. उसका breast carcinoma detect हुआ, stage 3 invasive ductal carcinoma, and she was given homeopathy. She responded well. Now 6 chemo has been done, and that lump size has been reduced remarkably. Just a dot is left, and the structure and shape of the breast has also been improved. And time to time, medicine was also changed. Sometimes symptom based, and in initial stage, she was also given constitutional, and she responded well. But at one stage, as you specified, that there was some evidence of aggravation, so it was stopped that movement. But after that, just symptom-based treatment is given to her, and she is responding very well. She is mentally, physically stable, have a positive attitude. But there is definitely not a pleasant history in her married life. So there is hope that she will overcome this. She will be free from cancer in another 2 to 3 months. Chances are there. So, sir, I want to ask, is that the cure, or are there will be the chances of recurrence, or the maintenance cause have to be stopped? Because
maintenance cause has to be stopped. Most important. Since I give a lot of importance to maintaining cause, especially in CA. If you are continuously maintaining cause, means like I told you, injury theory. You are continuously injured at a mental level.
Right, sir.
So there is going to be induration, multiplication, inflammation. So again, she is going to go back in cancer.
So she has to be away from those maintaining causes.
Yeah, maintaining cause. See, I'm giving you a simple example. Let's say cancer is a very big example. You are living in a marshy area.
Right,
and you have
sir.
got mosquitoes, and you are using a net, but mosquitoes are there inside the net, and the patient, and you're telling me to treat for malaria or dengue, and they're all malaria infected mosquitoes. Can you prevent it completely?
No, unless she is away from that area.
Yeah, until and unless she's away from that area, or she removes the mosquitoes from the net. What you can do what you can maximum do is keep the
Abhay, kindly unmute yourself. Thank you.
Otherwise, then where was I? What maximum you can do, that you can give that person medicine to decrease the episodes of malaria or decrease the episodes of dengue. Means you can increase the susceptibility or the sensitivity, I mean to say the strength, immunity of the person. But then he's 101% going to get it.
We have to focus on to enhance the immunity of the patient.
Immunity is a very broad term, but like I said, cancer has to be treated holistically. Physical as well as mental strength of the person has to improve along with medicine. So it comes, diet comes, exercise comes.
Yes, in totality.
Everything, mental as well as physical health of a person is very important, because I don't believe that you are continuously subjected to a stimulus, and you can make yourself so strong that you will not be affected by the stimulus at all. It is very difficult for a normal human being,
because it is a tendency of that person.
Yeah, because maintaining cause will be there.
Yes, sir.
Anything else?
Thanks, sir.
Thank you.
So you said about the ERPR positive. What is this ERPR?
Estrogen progesterone positive, tumor markers. Tumor, you get this already a biopsy. Whenever they usually suspect to hormone positive, tumors, breast cancer. That is why the knowledge of the disease is very important in cancer. You should know what you are treating. Harpreet sir, please tell the name of the Materia Medica book you prefer to read more. So one is Murphy's Repertory. Is an excellent repertory for. I use it a lot for cancer cases. Bonninghausen, I use it frequently. Grimmer, I use it a lot. As far as cancer, Farrington Clinical Materia, I use it. It helps me to understand more. So these are mostly the books I use, and I repertorize. Usually, I repertorize all the cases. Yes, Dr. Mitali.
So, how frequently or what should be the duration for us to repeat the tests depending on whatever cancer?
Now, again, it depends upon the pace of the disease, right? So, pace means if it is blood cancer, for example, now acute leukemias is a different ballgame totally. Extremely difficult to treat. You have to be very careful because they require blood transfusion. So, usme to we repeat it every weekly. And frankly, I don't have great results with that. As far as CML and all are concerned, once a month I repeat. PET CT, usually it is done after 3 months. And once the patient is very much better, 6 months to 1 year. Or you can, suppose if it is a lung, primary is lung, and you're treating lung, then X-ray chest once in 2 weeks, once in a month or once in 2 months. And tumor, I rely more on tumor markers, CA test, alpha fetoprotein, CA 19.9, because these are non-invasive tests. So from that you can get specifically liver cancer. Alpha fetoprotein gives you a good idea. Then if obstructive cases, gallbladder cancer, alkaline phosphatase, it is preferable to repeat every 3 weeks. To know, because in cancer, that's what I told you, patients are scared also. They don't give you a proper response. They don't give you a proper symptoms. because they don't want to go for surgery or they don't want to go for radio or chemo. They say, no, I'm very good, I'm very good. So it is difficult for you to judge whether the patient is improving or not improving. So without reports, it becomes difficult to diagnose. Thank you, Dr. Poonam.
Okay, I think Abhay, we had a very excellent segment. Dr. Charu is still, I think. Dr. Charu, please go ahead.
Yeah.
Good afternoon, sir.
Yeah.
Sir, please throw some light for the cases of children or infant cases of cancer, because um, we have very paucity of symptoms in such kind of
Yes.
cases. And, another thing is, we cannot rely on mentals and all. Those are not so clear. When during all this process of treatments and all, even the parents forget how really their child was, right? So it's very difficult to
Right.
end such kind of cases. So,
excellent question, Dr. Charu. It's quite difficult. Frankly, it is very difficult. I rely more on mental state during pregnancy. Such patients which are concerned, if I try to find out cause, and I had told you that I have devised a methodology which is beyond the scope of the seminar. Means I integrate astrology and homeopathy together. So from the chart, even if the child is 1 day old or 1 month old, 6 months old, I can analyze the patient in a much more better way. Means it helps me to analyze a patient in a better way, and it helps me to treat the patient. But it's difficult. Means either you have to rely completely on the pregnancy state of the mother. If once the child is 1 year or 2 years old, then it becomes more and more easy to prescribe. But before that, it is difficult. Especially you find children such small age, retinoblastoma, and you find ALL, acute leukemias. So both the diseases are difficult to treat. Anything else?
sure. Thank you, sir. That's it.
Okay. Okay, I think so. Sameer, Dr. Mitali, you want to ask anything?
You mentioned use of nosodes like carcinosin or thuja.
Yes. Yeah.
What potency would one go with when we are going with these remedies in case of cancer?
Nosodes, see, carcinosin and Cerinum, my methodology of prescription is usually 200 potency once a week or once in 15 days, depending upon how much symptoms, how much constitutional symptoms are present in such cases. This is how I prescribe. Means I usually, like I said, I give LM potencies, and I'm very sure of the remedy. Means there is a lot of suppression where the person is forced to do a lot of things against his will. Then I use carcinosin, and especially if there is history of cancer, I usually prescribe once a week. Carcinosin. If there is a history of worms and a carcinosin type mentality, I prescribe Cerinum. But then there is no fixed rule. This is what I have developed or I have seen results. Like Rustox is a remedy which I found excellent result in LM potency. Crotalus horridus, excellent results in LM potency. Then Arnica, excellent result in LM potency. While Lycopodium, I have tried LM potency, I never found very good results. I found in 200 potency better results, infrequent repetitions. Metals, centesimal potency, infrequent repetitions, I have found excellent results. So this is the practical experience. Means I cannot justify it according to Organon or this according to how the patients have responded. I have been able to use this methodology. Anything else? I think so we can end now.
Yes.
Dr. Samir,
Yeah.
yes, you can take over.
So we had an excellent session with Dr. Abhay Patil, and I'm sure that we'll have more such sessions from you, sir.
Thank you.
So excellent exposition of cancer and your experience, sir. So with your good experience, I'm sure we have learned a lot today. And thank you on behalf of Dr. Batra's Academy. I wish to thank you a lot for your experience and for your lecture. And we're looking forward to many more such lectures, sir. So,
Sure.
So, guys, we'll be continuing with this series of lectures. Next Sunday, we'll have Dr. Hardik Kamar, who's a homeopath from Gujarat and who's doing good work in oncology. And Dr. Abhay will also be with us during the course when we are doing the certificate course in oncology affiliated to MEHS. So we'll be learning a lot from him in the future also. So thank you, Dr. Abhay, and looking forward to see you again, sir. Thank you very much.
Thank you, Dr. Samir. An excellent course, I think, so your design. Because if we had this course 10 years or 15 years back, it would have helped us. We would have started from scratch.
No, but we are lucky that you are here now. So with your experience, we can make the course much more richer now.
Okay? Yes. Okay.
Thank you, sir.
Thank you.
Bye-bye.
Thanks a lot. Yeah.